Good afternoon, everyone. Alisa, Haushalter, Director of the Shelby County Health Department. I want to welcome you to the Thursday afternoon Joint Task Force update. Today, it'll be me and Dr. Randolph. I'll give a few updates and some key highlights, and Dr. Randolph will give some additional highlights, and then we'll open it up for questions. As of this morning, we have 41,125 cases. That's an increase of 257 over the last 24 hours. But over the last week, we've been averaging about 340 new cases per day, so that's a slight trend upward. While that's consistent with what we're seeing across the state and across the United States, our trend line upward is not as steep as some other communities, and I think that's a testament to all of our early work to contain the virus, but much of the current efforts as well to reduce transmission. And we'll talk more about that shortly. Unfortunately, we have had 604 deaths thus far. As we go into the holiday season, I do think it's important to think about the fact that these are individuals who were here in the early part of the year that won't be here for the holiday season, and the impact that that has on families as they've lost loved ones to the COVID-19 pandemic. One of the other things I wanted to note, in addition to averaging about 340 new cases per day, our case rate per 100,000, which you may see compared to other communities, is 36.3, and that's also trending upward. But what I wanted to spend a few minutes on was the age group that's mostly impacted. So at the current time, we have 9.8% of our cases in young people under the age of 18. We have nearly 14% that are 18 to 24, and then another 20% that are 25 to 34. What's important to note there is 44% of our cases are in individuals less than age 34. And then if we go up to age 44, 61% of our cases are in people younger than age 44. So much of my messaging is, while it's for all people, really pertains to those who are, one, actively infected currently and actively transmitting infection in our community. As of today, we have 3,162 active cases in Shelby County, and we have an additional 7,887 people under quarantine. And what that means is today we have over 11,000 people who are under an official public health order to either remain isolated or quarantined. If we look at hospital capacity, we're continuing to feel some strain in the hospital systems. Majority are in yellow, and in some areas there may be red relative to ICU bed capacity. Also, our testing capacity remains very robust. There is plenty of capacity for testing. We're really urging people to get tested even if they have minor symptoms or they've been exposed to others, or if they feel a need to be tested before travel or after travel. Our public health capacity, while we have added, as everyone knows, over 200 new positions to the health department, and the majority of those are filled, we currently have about 70 vacancies, and those are primarily part-time employees. We are seeing strain in the public health department as well, and that's just because of the number of cases, the demand for technical assistance, and the need for enforcement in addition to contact tracing. But a few key things that continue to come up through the data in Shelby County specifically. While we are all very concerned about asymptomatic spreaders, about 1 in 5 individuals is asymptomatic. Those are people who have no symptoms but still are infectious and pose a risk to others. That means 4 out of 5 people actually have symptoms. Those range from very mild symptoms, could be a fever, a runny nose, allergy-like symptoms, all the way up to muscle aches and pains or GI symptoms such as upset stomach or diarrhea. But of those 4 out of 5 people who are symptomatic, about 53% of people continue to go to work while ill and may work for anywhere from 1 to 3 days prior to feeling sick enough to go for testing. So we want to continue to reinforce the importance of staying home if you do not feel well at all. Very minor symptoms, again, can be COVID, and so we ask that you do not go to work, do not report to work if you have symptoms, get tested, and remain isolated until those test results come back. If they're positive, you have to remain isolated for a minimum of 10 days, and you can assist by identifying your contacts and making sure that they know to stay home and also to get tested. A few other things that I wanted to highlight, and we knew this previously, but I want to reinforce it because there's more research. We know that across the United States, outbreaks are associated with places where people cannot wear their mask regularly, particularly if they're indoors. So things like restaurants, limited service restaurants, or other places that people are indoors and taking their mask off, whether to eat or engage in activity, are really environments where there's high risk for transmission. So I encourage people to really think about going to a restaurant, a limited service restaurant, or a gym, and if they choose to go, making sure that they wear their mask for as much time as they can, really only taking it off while, taking a bite and chewing the food. Also, to make sure that you're trying to go on off hours so that there are less individuals in the space, and that can help us reduce some of the transmission as well. I also want to remind you that if you're going to be around other people who are vulnerable, so people over 55, individuals who have chronic illnesses, it's important that you wear your mask. But we broadly say if you're around anyone outside your household, wear your mask while you're in contact with those individuals. And then lastly, I'm going to reinforce the messages we've continued to reinforce. Masking, we've talked about that at nauseum at this point. Continuing to social distance, that's difficult, particularly as we go into the holidays, but really thinking about that 6-foot distancing, getting tested, as well as getting the flu vaccine. So I'm going to pause there and turn it over to Dr. Randolph for some additional comments, then we'll open it up for questions.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, Health Officer. Just want to highlight a few points, have a slight conversation. One is that per the health directive, we are allowing pretty much all businesses and services to operate in accordance with the safety measures outlined in the Health Directive number 14. These services and businesses are asked to submit a plan to show how they intend to operate, and if indeed the plan is approved, they are able to operate according to the Health Directive. In it, and as a result of this, enforcement of wearing masks and 6 feet social distancing would be highly emphasized, to the point where our position would be, you demonstrate the ability that you can operate safely under the Health Directive. And if we find that you are in violation, we get complaints or we get reports of outbreaks in your particular establishment or facility, we will investigate and subsequently eventually close for a minimum of 2 weeks if you're in violation. And so you're able to operate, but you must do according to the Health Directive and adhere to the safety measures in the Health Directive, particularly the wearing of the face mask and face covering. And this is very important in light of even the most recent news coming out of the CDC, that wearing the face mask does not only control the source, control the amount of respiratory droplets, you spreading the virus to someone and you not even know that you're infected, but it appears that even wearing the face mask protects you from inhaling as much virus as you would if you didn't have it. So you're protecting others as well as yourself by wearing the face mask. So we really want to emphasize that in addition to the separation, social distancing, the avoidance of crowds will be very important, as Dr. Haushalter has alluded to, especially in the holiday seasons. We know the tradition, we tend to gather at grandma's house and then go visit aunts and go visit others to see what all is on the table for that day, and we'll encourage you not to do so. Primarily celebrate within your household. Even when you gather, try to gather outside if the weather permits, wear your face covering and be separated. Dr. Haushalter mentioned that our current rate is roughly 36 per 100,000. Let me just sort of break that down to you so you can see what that really means. Given the population of Shelby County is over 900,000, that means that at a rate of 36 people per 100,000, we could have an estimate of approximately 33,000 people who may be infected in Shelby County, which amounts to about 3.5% of the population. Well, what does that really mean? That means that if you're in a building among a crowd of 100 people, that means that 3 or 4 of them could be infected with the virus that causes COVID-19. So that's why you don't want to be crowded. That's why you want to be in a well-ventilated area, and you want to wear your mask. I want to just echo also the importance, again, if you're sick or have symptoms, stay home. We're finding that a lot of our cases are occurring from people who are having symptoms, but they still feel the need to go to work, or to attend school, or to go to a restaurant, or to socialize. These are the major activities that seem to be contributing to the spread of the virus here in Shelby County. So if you're sick, stay home. You have symptoms, stay home. If you know that you've been around someone who has been diagnosed with COVID-19, stay home. Go get tested. We have various sites, a lot of capacity. In some places, utilization is 35 to 50%, and so use what we have available in terms of checking yourselves out if you're in doubt of whether or not you are infected. And again, as I've said before, just because things are open and legally open, are allowed to operate, does not mean that it is medically wise for you to participate or to attend. You need to assess your situation and take the appropriate measures to protect yourself. Last thing is to urge you to get your flu shot. If you haven't gotten one, get your flu shot. With that, I will open up for questions.
Brad Broders, Local 24.
Good afternoon. The hospitalization numbers I've noticed are now both in the red zone. What just kind of commenting on the hospital trends, are you more potentially worried than the summer surge in terms of the flu season coming up and the trends we're seeing with hospitalizations?
Well, yes, of course, you know, we're in the middle of the flu season. At this point, we are very concerned, but also, fortunately, it appears that the flu-like illnesses or symptoms aren't as high now as they were, say, last year this time. And that's good news. And that's partially due to the fact that because people are adhering to the safety measures required to protect you from COVID, wearing the mask, washing their hands, keeping the distance, practicing cough and sneeze etiquette. All these measures helps in preventing the spread of flu as well. But we're concerned because, it's just November. We got December, January, February, March to go. And there's that risk of overcrowding, overwhelming our healthcare system if our numbers continue to increase. Dr. Haushalter, do you have anything?
You mentioned staffing.
Yeah, and the other part of that too, and the critical part, hospitals may have the beds, but may not have the staff, the nurses, to tend to the beds, and that's really a crucial issue with our healthcare system in general, not only just in Shelby County, but state and nationally, is that they're due to the shortage in some areas of healthcare providers, professionals, then we're limited in having people to care for those who are in need of care.
Thanks. And as a follow-up to Dr. Haushalter, I know you were mentioning about the percentages of younger people getting infected. David Sweat mentioned it on Tuesday as well as the LeBonner doctor yesterday. What is your thoughts about extracurricular activities with young people? Because it's been a common denominator in most of these school children's cases.
So, we said early on that we believe that contact sports pose a significant risk, and we continue to say that. I would add to that any sport or extracurricular activity where there's close contact, likely, or close proximity where people are not wearing masks, they pose a risk as well. We are preempted by the governor from really directing what happens in the schools, including their extracurricular activities. So we've just put out that those are high-risk behaviors and activities. We think parents need to have information to make informed decisions, and we'll continue to work with the school systems to, one, identify cases, secondly, when there is a case, to do contact tracing and eliminate people from being around others if they pose a risk, and providing whatever technical assistance we can. But I do think ultimately parents need to be aware of the risk. They need to look at the data and understand that we do know extracurricular activities are driving some of our numbers. And it's not just the activity itself. Children and young people who play sports together or engage in extracurricular activities together also tend to socialize together. So they may be wearing a mask while at school, they may be wearing a mask while they're at practice, they may be cohorted, but then they may go outside and do things together. So also reminding parents to help their young people understand the importance of masking when they're outside of the school setting as well.
Sam Hardiman, Commercial Appeal.
Hi, Dr. Randolph, to follow up on your message to businesses, since Labor Day, how many businesses has the Shelby County Health Department shut down due to a lack of compliance?
I cannot give you the exact number. I would, if I had to guess off the top of my head that comes to mind, would be under 10, but I would have to double check those numbers.
Okay, thank you. And this is for both you and Dr. Haushalter, this follow-up. As of yesterday, we had 334 COVID-19 patients in Memphis area hospitals. That's 50 below what has been our high throughout the pandemic at 384 in late July. At what point of hospitalization level do hospitals begin to free up space by eliminating elective procedures? Has the task force had conversations about what that tipping point is?
I'll let Dr. Haushalter address that.
In regards to elective procedures, that's actually going to be an institution by institution decision, in part because how they do their elective procedures may vary. One, you have elective procedures that occur in the hospital itself, but then some may have satellite facilities where the elective procedures are done there. They are all monitoring very closely. We're also having ongoing conversations with the state health department about the commercial appeal site and when that might need to be utilized as well.
Kelly Roberts, WMC.
Good afternoon. I wanted to touch base first on the 24-hour death total. There were 10. Is that one of the highest that we've seen? But also, can you explain maybe what that reflects? I know that sometimes, it reflects several days of data when those 24-hour case totals and deaths are released.
Good afternoon. I apologize. I don't have the detail on those 10, and it could be several things, and sometimes it is reporting. So I will check on that and either have Chip or Joan get back to you with the exact detail of that.
Okay, no problem. And my second question, kind of what Brad was the subject that he talked about when it comes to schools. We are seeing, the numbers of cases and people under 18 years old. And we are seeing some, I don't know if you would call them clusters, some outbreaks in schools. I mean, are schools and filled with school-age children, obviously, kind of the next areas where we may see these hotspots? We obviously saw them in nursing home type facilities with the vulnerable. I mean, are schools right up next to them when it comes to just the transmission that's happening in those buildings?
I would say no, and the reason why I'm saying no is that in a nursing home, you have a large portion of the individuals who are in the nursing home day to day, so that would be the residents, who do not come and go. That the movement in and out is only from the employees, and they are visitors when there was visitation. Those are the individuals that bring COVID into the facility, and then there's transmission within the facility. The schools are quite different. 100% of people go in and out, in and out. That's the students, that's the teachers, it's other faculty and staff. And so there's difficulty sometimes teasing out if transmission occurred in the school itself or if it occurred in the social setting. I think the biggest takeaway that everyone should have relative to schools is what's happening in the schools is a reflection of what's happening in the community. We have all been committed to our children getting back to the classroom so that they can continue to learn, develop, and have their social needs met, but we have to get community transmission down. As long as we have high community transmission, we're going to see that mirrored within the school setting, and I anticipate it would continue to go up.
Greg Akers, Memphis Business Journal.
Hi, I know from remarks at other press conferences about six weeks ago, the response time to reach out to a new positive case was about 24 hours, yes. And then contact tracing would go from there. I wanted to see what the current turnaround time for that process to begin is now that there are so many more cases.
So when we had not just so many more cases coming in, but if you recall, there was a backlog in the data download from the state, and I'll talk about that more in a minute. That actually caused some increased stress on our system and our ability to reach out in 24 to 48 hours. And we also then had to prioritize. If somebody was already through isolation, calling them wasn't as much of a priority as someone earlier in isolation. And we worked with the state on that prioritization. We are looking at data week to week at the percentage of people that we contact in 24 hours and 48 hours. So the last time we pulled the data, about 40% of individuals we were able to contact within the 24-hour period, and that increased to somewhere over 60%, I don't recall the exact number, at the 48-hour mark. We do have people who don't answer the phone. So it's really important to think about the purpose of contact tracing is to identify the case and have them isolated, but the contacts and get them quarantined. So it's really important that people understand if they test positive, they need to be isolated for 10 days, and they need to help us identify who their contacts are. But really what I wanted to address is the overall sort of process so that people can see the actual times. So we know the lab turnaround times now are between 1 and 3 days, most of them less than 2 days. So if someone's tested on the first day, they're going to get their results back from the lab, likely by that day, 24-hour turnaround or 48-hour turnaround. The lab also then reports to the state health department, which is different than most infectious diseases. They report generally locally. So it gets reported to the state health department, and it may be another 1 to 3 days before it comes to the local health department. So there are times when we receive the report, the person was already tested 4 or 5 days earlier. So there's several layers in that. I do want to reinforce that the labs are turning around the data really quickly and getting that out to the customers who were tested. They're also reinforcing when they notify someone that they're positive that they need to be isolated or quarantined. We will continue to monitor our turnaround times and, as needed, adjust our staffing to be able to meet the needs of our community as our numbers go up.
Thank you. And one follow-up, is there any, do you have conversations with the state about, is there any way to change that process so that you could be notified directly rather than the state as kind of a middleman?
Well, I think given the number of cases relative to the pandemic, this is the most efficient manner. So with other infectious diseases, let's just use tuberculosis as an example. When the healthcare provider orders the test and the test result comes back, the healthcare provider notifies the health department. The lab may also notify the health department, but the primary report comes from the provider, not the lab. But because of the volume with the pandemic, the standard in many states, not limited to Tennessee, has been that the labs be the reporter rather than the provider, and that goes straight to the state. The state is working to make that a much quicker process, but it is actually the most efficient given the sheer volume that we're seeing locally. The other thing that's quite different with the pandemic is both positive and negative tests are reported. Historically, only positive tests are reported for other infectious diseases, and so it's a significant volume when you look at all of the tests done day to day statewide. That's also why the state system has had to be updated recently, just because of the volume that was coming through the system.
Jane Roberts, Daily Memphian.
The NBA has come out with some guidance about what it will do for the coming season as far as players and spectators. Can you help us understand what it might look like here for the Grizzlies as far as spectators being tested or capacity issues in the arena?
So I apologize because I haven't read their most recent guidelines. What I have is more anecdotal information, so I won't comment too detailed. At the current time, we can do that on Tuesday. We'll make sure we've gone through it in significant detail. We have worked closely with the Grizzlies from early on, particularly with their physician in charge around testing, what it might look like. I know there's some upcoming meetings where we'll be having conversation. So I would just say at the current time, that's still in conversation, and we will work with the Grizzlies to do things as safely as possible here in Memphis. You have a follow-up?
So much. No follow-up. Thank you.
We are out of time. Are there any closing messages from any panelists?
So the only thing I want to comment really is not on COVID specifically. If you've kept up with the news, on this Saturday we have a unity walk against gun violence. I want to remind our broader community that we have many health issues that impact Shelby County, and gun violence is one of those. It's a historic issue that we're challenged with. So if you have the opportunity to come out and join the unity walk on Saturday, it starts at 9:30 at the Juvenile Justice Center. What we would also ask is that you remember to stay home if you're ill, so don't join us if you're ill. Wear your mask and social distance. I trust that as much effort as we've put into COVID, if we put that much effort into gun violence, we can make a difference for our community. Thank you.
Thanks, everyone. We'll see you back here on Tuesday.